You're watching the eHealth Network.
To me, facial rejuvenation is just a method or methods to get your face looking younger.
Actually, they're not wrinkles, but I guess they're called the laugh lines, these clown marks that, if I smooth them out, I probably would look younger. And then when I laugh sometimes, I crinkle a lot on top of my forehead. So I would definitely get rid of this and this.
When I get older, I probably will maybe do some Botox, a facelift. If I get all wrinkled up, I'll probably do something for my skin to make it look younger.
I've noticed recently that, more in the past few years, wrinkles showing up. They weren't there when I was younger. And I would take anything, to help get rid of all these lines around the face here, especially under the eyes.
As the years pile on, we all start to feel their effects. We need more timeouts during our weekend basketball games, our knees start to ache whenever it's going to rain, or for whatever reason, black socks with sandals sound like a fashion win. But for some people, worse than the aching joints and the 4 p.m. dinner hunger pains is when other people can see the signs of aging on our faces. I'm talking about the wrinkles, the age spots, the sagging skin. For some, there's no amount of laughter that can justify those laugh lines. Well, luckily for them, there's always the option of facial rejuvenation, which can virtually erase all of those signs of aging.
I think facial rejuvenation is basically the art of being able to create a more youthful, natural appearing look that can fade away the signs of aging. Now, to do that, there's a million options, but it starts with medical skincare as well as skin resurfacing, whether that's microdermabrasion, chemical peeling, or laser peeling. And all those options for skincare are customized based on the patient and their skin type. The next step beyond that is the ability to replace volume and today use some of the minor touch-up procedures such as Botox or neurotoxins or fillers such as hyaluronic acid fillers like Restylane, Perlane, or Radius to actually restore some of the volume and give people that youthful look that they want. Finally, the third aspect of facial rejuvenation is actually operative, or it's actually surgery or mild surgical procedures that can actually remove the signs of aging, because that's the best way to remove the bags and the jowls and the excess skin that accumulates over years. So facial rejuvenation is a spectrum, and it's not one particular thing. It's actually tailor specific to the patient.
These treatments have to be tailored to the patient because each of us develops different signs of aging due to different causes. For some of us, it's just a genetic factor. For others, it could be sun exposure, improper diet, or poor skincare. Facial aging symptoms are also exacerbated by excessive exposure to pollution, or smoking, or wind, or extreme heat and cold. So, if you're still in a position to prevent aging, it's best to avoid all those things, and then some.
The number 1, 2, and 3 best way to improve your skin is to avoid sun and wear sunscreen, because photoaging is the number 1 cause of many of the chronic conditions, including skin cancers, which are basically at epidemic levels right now in the United States. So good skin care and good sun exposure and management of sun exposure is key. But behind that, moisturizers, things that can do a little bit of resurfacing at home. Like there are certain medications like retin-A creams that can actually exfoliate the skin quite well. And I think, again, that's tailored specific to the patient type, their pigment tone, and what they're looking for. So for that, the best thing to do is go to a doctor for a consultation.
There are a lot of creams and spa treatments out there that also promise to reduce the look of aging. We're not going to discredit them. Every person is different, and you may just achieve the results you're looking for if you find the right product. But if you want fast and quality results, your best bet would be to contact a facial specialist.
We're talking about going to surgeons who are facial plastic surgeons and who have specialized in plastic surgery of the face and neck specifically. Not only are they board certified surgeons, but they've dedicated 5 to 7 years of training specifically in the anatomy, the structure and function of the conditions that affect the face and neck. And I think Even though facial plastic surgery is a personal decision, for the only part of your body that you don't routinely cover to achieve your personal goals, I suggest you trust your face to a specialist.
These specialists are also in the best position to suggest the best treatment for you. For example, everyone's heard of Botox, but there are other wrinkle-fighting injectables on the market that may work better for your skin. A specialist can offer you information on those products you don't hear about on TV all the time. Now, if they could only rid us of the tendency to wear black socks with our sandals. I'm Dr. Keller Wortham, and you're watching the eHealth Network. Stay healthy.